Hello, my name is Kiesha White. This video will be a summary of the controversies of circumcision. As explained by Lu Kong, the lack of consensus with regard to the actual function of the prepuce, coupled with the debate of the benefits of circumcision, have been controversial among the religious and cultural groups. The most common reason for circumcision is largely attributed to culture and religion. Culture and religion do not advance any scientific basis for this procedure, specifically the cultures of Jewish and Islamic individuals. In Jews, circumcision is routinely performed on the 8th day of the child's life and can only be performed during daylight hours. In Islam, circumcision is one of the rules of cleanliness. Islam is a religion that encompasses all aspects of life, and circumcision is an act that represents the innate disposition and natural character and instinct of the human creation. Circumcision is the oldest surgical operation known to have been performed, with the earliest available records dating back to at least 6,000 years BC, and evidence suggesting it as a rite of puberty in Aboriginal tribes before 10,000 BC. Existing scientific evidence demonstrates potential medical benefits of male circumcision, such as the prevention of STIs and/or STDs, but also an improved body image and sexual satisfaction. Some may argue that circumcision can withdraw the right of an infant's right to self-determination, but also the fact that the procedure can cause a psychological hindrance of sexual experience and increase anxiety. According to Navarez, other psychological issues that stem from circumcision is the pain of the procedure that can alter the brain in infants, the hormone cortisol, which is associated with the stress and pain, spikes during circumcision. This researcher also stated that during this procedure, the neonatal period is associated with site-specific changes in the brain that have been found to be associated with mood disorders. Navarez explained that studies of men who are circumcised in infancy have shown that some men experience symptoms of post-traumatic stress disorder, PTSD, depression, anger, and intimacy problems that were directly associated with the feelings about their circumcision. The issue posed with questions that lead to a debate in regards to circumcision are: who should be circumcised, questions regarding the definition, methods of the procedure, risk and complications, whether circumcision is at all necessary, and finally, who should perform the circumcision. However, the data is not sufficient to recommend routine circumcision. In all, certain circumstances, there are potential benefits and risks. To make an informed choice, parents of male infants or males in general should be given an accurate and unbiased information and be provided the opportunity to evaluate this decision on their own.